You have a slow heartbeat. This you should not ignore. It could be a warning that your body is not functioning appropriately. Watch this to the end to know more what would be causing your heart beat to be slow. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. So your heart is beating slower than usual. What could be the reason? What is the normal heartbeat of an adult person? Usually, we expect your heart rate to be between 60 to 100 beats per minute. And you can be able to check your heart rate by just putting your hand at the radio artery. The radio artery, you usually get it just below your thumb at the least you can feel beat at around that area, and you can be able to tell what is your heartbeat by just counting. If you count for a minute, your normal heart rate should be between 60 to 100, and you can even feel how strong is your beat, or is it beating consistently, and this can tell you something about your heartbeat. So when you have a heartbeat that is less than 60 beats per minute, then we say that you have a slow heartbeat, a condition we medically call bradycardia. This can be normal if you pulse is taken when you are asleep because your body is on a slow mode. For those people who are athletes, if you have been practicing, you have learned to tolerate excessive body strain, then your heart adapts to this by beating at a slower rate. It is able to conserve energy. So when you are an athlete and your heart rate is less than 60, that is not surprising. That would be a normal finding. But sometimes, if you are a normal person, you do not exercise that aggressively, and your heart rate is less than 60, this could be a signal of a serious heart disease or a hormonal issue in your body. So early detection prevents episodes of fainting, stroke, or even sudden death. So know your heart rate. So, when is a heartbeat normal when it is less than 60? One, if you are a highly trained athlete and you have high levels of endurance, that is normal. If your heart rate is taken when you are in deep restorative sleep, your heart rate beating less than 60, that would be a normal. If you have someone who have learned to do meditation and relaxation, like breathing exercises, you do meditation, like you can do meditation 30 minutes in the morning, 30 minutes in the evening, and you consistently do this, then you train your body to be able to accommodate and to relax, and this will give you a slow heart rate. So that would be a sign that you have just adopted. And then usually normal slow heart rates, they are not accompanied with dizziness, they are not accompanied with fatigue, they are not accompanied with chest pain, and you will not have a fainting or dizziness episode. So if you have other symptoms apart from the slow heart rate, then this could be a danger sign. So when is a slow heart rate dangerous? So we need to know this, that if you have lightheadedness and you have near or you have fainted several times, and I've seen this in several of my patients, they have low heart rate, they have had episodes of fainting, or they are getting easily tired, that would be a sign of either hormonal problem or a heart problem. If you have unexplained fatigue, you are feeling tired and then your heart rate is less than 60, it could mean a heart disease or a hormonal issue. If you have chest tightness or pain, it means that your heart might not be functioning as efficiently as it should, and your body is being not supplied with the adequate oxygen supply. Then, if you are short of breath, if you have confusion or memory lapses, or if you have had a syncope or fainting episode, that would be a sign that your slow heart rate is not a normal thing. So what are some of the causes of your heart rate to be low than it should be? One, if you have what we call a heart block. This is abnormal wiring of your heart, and it might mean that your atrium, which is the upper part, and the lower part of your heart, the ventricles, are not coordinating as well as it should. And so that gives you what we call a heart block. And the effect of this is that you do not have adequate supply of blood to your vital organs. And this can lead to easy fatigability, can lead to syncope or fainting attacks, and also you may have easy fatigability. Then if you have low thyroid hormone, then that low level of thyroid hormone would slow your pulse. Then if you have electrolyte imbalances, like you have low potassium, low calcium, that could be a sign that your hormone imbalance is making you have a low heart rate. Some medications, there are those drugs that we call beta blockers, and they all end up with role, like propranolol, nebivolol, bisoprolol, uh, propranolol, cathedral. These drugs, they are made to lower down your heart rate. And if you are taking them, then your heart rate might be lower than normal. Sometimes you may have a low heart rate that it jeopardizes your health. So you may have to either remove the drugs or even adjust the dosages. Then those people who have sleep apnea, it means that they may have oxygen dips at night. Apnea means you have difficult breathing, you are not getting adequate oxygenation, and this can affect your health. So how can you tell whether your heart rate is normal or abnormal? Sit quietly and locate your pulse at the wrist or at the neck. I've said that you just need to hold your heart like this. You can hold it on a table like I'm doing now, and you just place your two fingers on where this is your thumb, and at the base of it, where you have the bone that we call the radius, you can feel the pass. So if you hold there and then you count for 60 seconds, then you can be able to tell what is your heartbeat rate. And then you can be able to, in a minute, how many times is your heart beating. And then you can know, is it below 60? Is it between 60 and 100, which is normal, or it is over 100? When it is over 100, that is another topic that we'll discuss another day. So if you have a heart rate that is less than 50, you have symptoms that we have talked about, then you need to seek with your healthcare provider. Or you can also use a smartwatch. These days we have watches that you put, and then it will tell you what is your heart rate. And if your heart rate is lower than 60, then you know that there is something that is not right with either your heart or your hormones. So how do doctors diagnose and treat heart problems, especially which are associated with a low heart rate? They use an ECG. An ECG is a machine that is put in your chest, and we have what we call leads. They are put along your heart, allowed they monitor your heart, the front and behind, and they can be able to tell how your rhythm is. It is monitored possibly like in a minute or 2 minutes, and then it will produce your heart rate in a graph. Then it will show you the rate of your heart rate, how regular is your heart rate, and do you have any abnormal beat in between the normal beatings, or is your heart irregularly irregular? And you can diagnose many of the rhythm problems using an ECG. Then there's what we call a Holter monitoring. This is a machine that is put on you. You move around with it for 24 hours, and it will show you how your heart has been beating in the last 24 hours. It is usually done for patients who complain that they are aware of their heartbeat, or their heartbeat is beating too much. And when you do the normal ECG, what I've talked about, that stressing of the rhythm of the heart, and you don't find anything, then you put them on a Holter monitor. Then your doctor can also monitor your electrolytes. I've talked about potassium, I've talked about calcium. These are hormones, electrolytes. If they are low, then your heart beats low than it should be. And it could be a sign of an illness. It's a gland that is just at the base of the neck. I have talked about its problems. It's called a thyroid. Sometimes it can be missed out and presents in a very unusual way. And when it is not functioning and producing adequate hormones, then your heart tends to be slower. Then sometimes you can do sleep studies for those people whom you think they have difficult breathing, especially at night, and they have episodes of loss of breath at night. Then if you have a low heart rate, then you will adjust or stop the drug that could be lowering your heart rate. And if you have a heart block, what I've said that there is lack of coordination of your upper and your lower heart, you have a heart block, then you may need what we call a pacemaker. A pacemaker is a machine that is put in your heart and helps it to beat consistently at a normal rate of 60 to 100, so that this is what is compatible with your life. So how do you maintain your heart health on a daily basis? Regular, moderate exercise. We say that if you are doing 150 minutes per week of walking, jogging, cycling, swimming, or any other aerobic exercise that you like, that will be healthy for your heart. A balanced diet rich in potassium and magnesium. You can also, for nutrients like magnesium, you can supplement, especially if you have symptoms of deficiency. And if you go to have a blood test and your potassium or magnesium is measured and is deficient, you can be supplemented. If it is very low, then that would be an emergency. It is life threatening and it needs to be supplemented as an emergency. But also there are foods that are very high in potassium, like green leafy vegetables and even things like bananas. They have a good supply of potassium. Then annual thyroid screening after the age of 40. Because if your thyroid hormones are low, then you have no energy, your heart will beat slowly, and you feel tired. Then limit your alcohol intake. Alcohol and smoking, they affect your heart in very serious way. They can lead to what we call cardiomyopathies. They can lead to coronary artery disease. When I talk about coronary artery disease, I will keep showing you this blood vessel. That's a normal blood vessel. That's an artery that has been blocked. And this process is caused by smoking, alcohol, and the high cholesterol, and also conditions like diabetes, hypertension, and HIV. So you try to avoid alcohol and you quit smoking, because it will sooner or later block your vessels, and then you have inadequate blood supply to your heart muscle. And then look at the medication that you are using. And if you are feeling that your heart is beating slowly, discuss this with your health provider. So what do you need to do on a daily basis? Check your pulse tonight. I've said how you can do it. Please do it and tag me, and let's keep checking our heart rate. Uh, Log your resting heart rate for 1 week and see how is it behaving. Share your average heart rate in the comments below this video. Let's know what is your heart rate. If you count it for 1 minute, or if you have a smartwatch that is able to take your heart rate, tell us what is the rate, and then you'll be able to review and audit it. Is this normal? Is it abnormal? Let's share in the comment section of this video, and tag a friend who is always tired. It could be his heart that is not beating adequately. Save a life. You have a duty. Thank you very much for watching. We meet in the next video.